wonder if you could give a sense. Our traditional healthcare system has been fixing problems. You know,
Right.
you get sick, you go.
Right,
And
right.
Is that still gonna? Do you still see that as the primary model, or do you see a shift towards promoting health?
No, I think the goal is with these medical homes, these primary medical homes that basically are going to be created where you will have a medical person to go to. I think the goal is to work on prevention. The goal is to reduce, smoking, reduce obesity, make sure people get in for their mammograms. That is definitely the goal. I mean, I think we have to get there by realigning where the money is right now. And insurance companies are saying they want fewer specialists, and they want to make sure people don't get the tests that they don't need. So I think you've got to take the money that we're spending on healthcare and make sure that there is some that's going to these preventive efforts. Otherwise, it won't work, because we can't dredge up more money just because we believe in prevention. I mean, I think anyone you talk to in the healthcare field will tell you that prevention is the key and the goal. But how much it can actually go to that is, unknown. And I think, basically the health policy people are trying to focus on the tobacco incidents, prevention of, people starting to smoke, the drugs, the alcohol, and the obesity issues. I think those are the ones that they've focused on, because those are the ones that absorb so much of the healthcare dollar when they're untreated. You have a question?
The questions I have are actually too large to even answer.
No, go for it. Go for it.
Well, I'm curious, as you've moved from, and I know you from way back, Diane, Mark Levitt, I don't know if you remember.
Right, sure, of course. You should be up here talking.
No. As you moved from print to the internet,
Right.
Did you notice a shift in sort of the ability of people to consume what you read? You were just saying they want to hear right now.
Exactly.
But they not only hear right now, they only want 140 characters.
Right, exactly. Oh, the tweet.
What have, yeah.
Right, exactly.
And so have you found that you can't write an in-depth
That's interesting.
analytical article and have it read? Or maybe you have found, yes, you can, because you've got sort of a readership that's still doing it. I'm just curious about that.
Well, that's an interesting question, because that gets back. I don't have a lot of long, in-depth articles, and the reason is because I have to pay people to write them, and so that I limit and I pay by the word. But I think that's a really good question to look at in the long term. I mean, where people really read in-depth articles. I think I believe that people want the quick news. They want to know in the first couple paragraphs what it's about, and if they're interested, they're going to go on. That's why I limit the articles as well, which I think is difficult, because if it's in a print form, like a New York Times or even the Oregonian or whatever, they will read to the bottom oftentimes. But I think that's one of the deficits of the, deficiencies of the internet, that you got to have it right up. And so what I try to do, we have a headline, then we have a subhead. And I try to bring information from the bottom of the story up to the subhead. So maybe people will say, oh, Bob Polari made $5.5 million in 2008. And they'll want to know what really happened, so I have to go all the way to the bottom. But I think it's really hard. I'd like to know your other questions.
Well, give other people a turn.
Okay.
But I was curious about that.
Right. I think you're right about that. I think that's one of the problems, because people want quick news.
And healthcare is sufficiently complex. It
It
seems
is.
to me the solution is to throw out Mubarak and bring in,
Right. Exactly.
death to the dictator, long live the new dictator
no.
kind of phenomenon.
Every problem creates its own. Every solution creates another problem. I mean, you fix one
Right.
thing, and then you have another problem over here,
Particularly.
just waiting, because it's not an easy fix to deal with all these, complex issues.
So
But-
do you think that when the Affordable Care Act was passed,
Right.
and the process that went on,
Exactly.
that actually the health care bill we got was driven more by sound bites and anti-sound bites than by thought?
I think the healthcare bill was driven by lobbyists.
Mm-hmm.
I mean, I don't know about sound bites. I think the problem too is that, with a lot more people rely on, I don't know if a lot of people rely on TV and radio, but they just give really, really quick sound bites, and somebody says, oh, I understand what that means now, without going any further. And I think the acronyms too in healthcare, there are so many acronyms, and people just get frustrated. One person wrote to me and said, I just got tired of reading this article, Diane, because there were so many acronyms, I just gave up. And so you have to repeat and repeat and repeat. And then the question is, with the internet, you're getting new people all the time, and how much background do you give? How much do you have to go back to explain what it all means, you know. Well, the Health Policy Board, what did it really do, and what was House Bill 2009, and rather than just talk about here's what's here and now, so you're always having to go back and forth and back and forth, I think more so than you would have to do in a newspaper. So that's another problem, but, you know, it's the way people are going to get their news. I'm surprised, too, more people don't respond to give story ideas. I'm not sure, maybe, I mean, we're not doing everything we can, but I'm surprised that more people aren't responding to us in that. And then the other thing is about the internet, you get comments, as I mentioned, which is really great, but people prefer to be anonymous. So you don't know who's saying what. And in some reason you figure, well, why? Because they want to criticize something. Well, of course they don't want, you know, they don't want their name, but, you know, we thought, well, maybe we should require people have their name. But then people wouldn't send in comments because they'd say, I'm not going to share my name. So that's a difficult issue to navigate.